UK, but also the Heysel disaster as well in Brussels. In the UK, it certainly led to a review of safety within football grounds, but all sports stadium. And the initial concept of a more safe stadium, a more healthy stadium. How can these be safer and more healthy environments to come and visit? At the same time, during the 1980s, and we've heard about this earlier today in the form of healthy cities, a settings approach to public health was developing using everyday concepts such as schools, hospitals, prisons, the workplace, to improve the health of people who actually interacted in those environments. But then again, I ask the question, so why are stadia themselves actually useful for promoting public health? Well, let's look into stadia a little bit further. They're certainly used by millions of people across Europe each week. Not only the fans that visit stadia on a Saturday or Sunday afternoon, but also many thousands of staff and also, importantly, volunteers as well. The environments of stadia, certainly traditionally, have been in less affluent areas. And I think, as we know, less affluent areas also equates generally to areas of high health inequalities as well. Certainly in the UK, many are still based near to dense urban housing, and in terms of the offering that they give to fans on a match day, they traditionally provide food and drink options that are of a fairly low nutritional value, high in sugar, high in fat, with some European stadia, not in the UK now admittedly, but some European stadia still allowing smoking within the stadia environment and also sale of tobacco products. So, this is over to you guys. What does our typical match day fan look like? I know it's after lunch. I know that everyone's a little bit tired and it's getting to Friday afternoon. So, hands up anyone here who's been to a football game, a rugby game, any professional sports game in the last year or two? Anyone here? Quite a few people. Keep your hands up. Keep your hands up. Right. That's good. Apart from one person at the back, this probably defines the next slide. And what do you think are some of the defining characteristics of a football fan or a rugby fan on match day? Who do these people look like? Anyone? Well, okay. I think we've already seen it. Apart from one person who put their hand up, it's men, isn't it? Men generally go to football games and rugby games. Not the most healthy people in the world, and this is the type of audience that we can hope to actually target in terms of health interventions through sports stadia. So a high percentage of people who attend football games or professional sports games are men. They're generally over 30 years of age, and of course these are traditionally people who are hard to reach in terms of health messaging. They don't naturally take up lifestyle messages of healthy eating, greater physical activity, smoking cessation, etc. Over and above that, these groups generally don't access healthcare particularly readily. If I'm a man in my 40s or 50s, if I find a strange lump perhaps, if I'm persistently going to the toilet overnight, slightly strange things are starting to happen to me, I don't sit down with my friends and discuss this as a man. This is not a normal thing to do. So how can we find ways of actually targeting men? And we would say that actually the loyalty that fans offer to their football team, their rugby team, cricket team, this loyalty that they have and this trust that they have with that brand is a very good way of delivering these messages. So what we have said is this definition we put together. A healthy stadium is one that promotes the health of visitors, fans, players, employees, and perhaps most importantly, those living in the surrounding community near the stadium. So we think that by adopting this definition, by adopting this clause in the policy of a sports stadium, we can help to promote a healthier environment for both fans and staff. We can do some targeted work concerning men's health issues and also address some of the health inequalities in local communities near to stadium. I'm not going to read through all of these. These are just some of the potential initiatives that could be delivered through stadia. And just concentrating on some of the lifestyle activities, healthy eating options can be implemented in stadia. It doesn't have to be just burgers and fries and high calorific food and high sugar food and alcohol. Physical activity schemes, not just subtended by stadia in the community, but active travel schemes to and from stadia, bike routes, bike lockers for stadia as well, travel routes, making sure that not just the facilities are there, but they're actually promoted by the club as well. This slide is really just guiding through some of the partnerships that can be made, some of the key players in terms of health and well-being, and trying to situate sports stadia as part of that basket of partners. The ones in green are generally the partners that we've worked with, so transport providers, clearly health agencies, but really importantly now the voluntary sector as well. But of course this takes both sides of the equation. It's two sides of the coin. There is health agencies generally wanting to promote public health, but also there has to be something in this for stadia, and I know that we have some stadia representatives here today. Why would they be interested? You know, they're generally a private company. Why would they want to engage in the health of their communities? Well, the definition is that we've given as advancing business objectives, but also alongside advancing the public health objectives of the surrounding community. And that can very much be a business case, a profitable business case. It can help to promote new revenue streams, so healthy food options that perhaps more children or women would like to opt into on match days, raising levels of income through that particular stream. Lowering costs as well, making sure that things are as energy efficient, making sure that things are recycled, bringing down costs of operation. Certainly in the UK, but I know other countries as well, by actually conducting some of these initiatives, they're able to access new funding streams from their governments, matched funding that can help to roll out these schemes. And of course, this is really part of maximising the corporate and social responsibility that clubs have to their communities. So how do we make this happen? This is just a few guidance points. What is really important is don't come with preconceived ideas of what you want to do with your community. Make sure that you look into the health priorities of your individual community. There's no point in running a whole scheme on oral health or on cardiovascular disease if your community does not require that. Make sure that you've looked at the data of your local community. In terms of language, certainly from health agencies, I know that there's a huge propensity to speak a technical, research-based language. Don't try and speak this to businesses such as football stadiums. They won't want to speak this language. Speak as though you're making a business proposition. In terms of leadership, making sure that there are clear roles and responsibilities, and also setting out an action plan that is achievable, and making sure that you have enough time to achieve some of these initiatives, or at least to evaluate them, at least 12 to 18 months. And of course, if these initiatives are successful, making sure that the board of your stadia or the board of your club get to hear about this success, to make sure that they're mainstreamed. Shout about it, do some good PR on this. You know, don't make sure that this is something just with your community department. Make sure that it's part of the everyday running of your club. As I mentioned, we were funded really to kind of take this concept from the UK, to take it from really Merseyside in the northwest of the UK to a European level. We were funded by the European Commission to do that, and that was a 3-year project, and the two main outcomes for that. We ran an audit of current practice to see what healthy-based activities were currently taking place in Europe, and UEFA helped us in terms of mailing out that questionnaire. And the main activities that we found were in the areas of healthy food options, smoke-free stadia, but also physical activity schemes. And then perhaps most importantly, we've put together an interactive and also paper-based guidance toolkit for stadia. That's a point-by-point, step-by-step plan for how you can put these initiatives in place, how to put partnerships together. And I have some copies in German actually out on our table that's towards the back of the auditorium. And from that, here's some of the guidance criteria and some of the case studies that we've put together. But from that, we garnered quite a lot of examples, and I'll just go through about 3 examples now The first is of a very large indoor set of arenas. It's 2 arenas, one for ice sports, one for athletics and gymnastics, based in the Vasa region of Finland. That is really meant for professional sports, so predominantly ice hockey and athletics. But the intention of this scheme was, okay, there are certain times of the day when this arena is not being used so readily, so let's let local companies, let's let their workforce use this for a much reduced rate. These are fantastic facilities. Why don't we let businesses use this to increase the health of their staff? And in fact, then the model has been furthered to allow the general public, the community, to use this. And in the Vasa arena, they've actually put the whole brand together. They've created this Hair Frisk, this healthy brand, which has also included healthy food options as well. They've engaged about 120 businesses now, and of course this is not only an increased revenue stream for their stadia, but this is also improving the health of their communities. The next case study, this is the new Aviva Stadium. This is the national stadium in Ireland for football and rugby. So this is a 55,000 stadium, and they've joined the network, and they've now taken the policy that they're going to have completely no smoking within their stadia, no sale of tobacco products, and even more radical, they're not actually allowing anyone who exits the game to have a cigarette to then re-enter the stadium. It sounds quite militant, I know. But the point of this is that stewards who let people go out to have a cigarette, they will fully brief them in terms of local quick schemes. And there is also a commitment for all stadia staff who smoke to attend local quick schemes as well. And finally, closer to home, this is Everton Football Club in Liverpool. And this is a very interesting, really successful project that has used physical activity in football to address mental health issues. They have set up a set of leagues called Imagine Your Goals, and these sessions are meant to support the key themes of participation, competition, but perhaps most vital, inclusion, and understanding that people do have mental health issues and people can talk to other people about them. A direct consequence of this is that 35 users have completed coaching courses, and 4 users are actually now in full-time education and employment. So that's 150 regular participants that are now taking part in this league. And just to finish with a brief opening to the network that we now run. The network was formed in early 2010, and its intention is to work as a communications hub, to share best practice, to share examples across Europe from different types of sport and different initiatives. And we also work as an advocacy and lobbying voice for health and sports stadia. We're supported by the World Heart Federation through its partnership with UEFA, and in 2 years' time we're going to be working as one of UEFA's football and social responsibility partners to deliver physical activity and